what is the treatment of prostate cancer? Cancer that grows in the prostate gland is called prostate cancer. Prostate cancer is the second leading cause of cancer deaths among men in the US. About one man in six will be diagnosed with the prostate cancer during his lifetime, but only one man in 34 will die of the disease. In the early stage, surgery and radiations may be used to remove or attempt to kill the cancer cells or shrink the tumor. Doctors will usually advise you to undergo a surgical operation. You will then be given some medications to take. Many studies have shown that these combinations reduces the pain experienced by men to a great extent, especially if the prostate cancer has spread the bones. The cancers will not totally disappear, not will you live longer. Seek medical advice too, and you would be in a better position to decide according to your own health and your personal values. Medications can have many side effects, including hot flashes and loss of sexual desire. Urinary continence can be possible. Complications of surgery. Also, a form of treatment used for early stage cancer is a high intensity focused ultrasound (HIFU). This procedure is carried out under anesthesia or using a local spinal anesthesia, and a probe is placed into the prostate gland through the rectum. A beam of a high-intensity focused ultrasound is then used to raise the temperature in the area of focus and thus to kill the cancer cells. Another prostate cancer treatment option is radiation therapy. This prostate cancer treatment includes the usage of radiation of high energy from protons, neutrons, gamma rays, and X-ray, as well as the other sources to kill the cancerous cells and to shrink any existing tumor. There are two ways the radiation therapy can be administered as prostate cancer treatment. The first is from a machine that is located outside your body called external beam radiation therapy, or you may have material that is radioactive that is placed in your body near where the cancer is located. This is referred to an external radiation therapy. A relatively new technique which is still being evaluated is known as cryosurgery. During cryosurgery, which is carried out under anesthesia, few probes are guided into the prostate using ultrasound, and the cancer cells are killed by freezing them. The form of treatment used for early stage cancer is a high intensity focused ultrasound (HIFU). The procedure is carried out under anesthesia or using a local anesthesia, and a probe is placed into the prostate gland through the rectum. A beam of high intensity focused ultrasound is then used to raise the temperature in the area of focus and thus to kill the cancer cells. For late stage prostate cancer, hormone therapy is used, and this is designed not to attack the cancer itself but to target the male hormones, in particular testosterone, which the cancer cells need to grow. In cases where hormone therapy proves effective, EV systematic radiation therapy or chemotherapy may be recommended. The outcome prostate cancer varies greatly, mostly because the desire is found in older men who may have a variety of other complications, disease or conditions such as cardiac or respiratory disease or disability that immobilize or greatly decrease their activity. Whatever the stage of your cancer is, the importance to consider all of them options carefully and the way the advantage and the risk of each carefully before choosing the treatment that is the best.